Hey, howdy everybody. This is Dr. Neil Guymon, Dr. Eye Guy, and I'm here with Dr. Aaron Smith from the Stone Canyon Eye Show, and we're actually doing a video series going over specific eye doctor secrets, answering specific questions that we get quite often. And this is part 4, and in this video we're actually sharing something special, how we can actually give excellent vision to people that usually can't get great vision with glasses or soft contacts. Let's focus in. So in this video, we're actually talking about specialty contact lenses, specifically scleral lenses, which we both fit on patients and have had great success, great experiences, some funny experiences that we'll tell in this video. It's funny. But yeah, so just kind of get started. Scleral lenses, really on my list of experiences as an eye doctor as far as helping patients out, they usually involve scleral lenses as far as giving patients some of the best vision that they can. I mean, I have a lot on this list where a patient might come in and we fit them with a scleral lens. They might have keratoconus or something wrong with their cornea. They've been wearing glasses or normal contacts or even normal hard contacts. We fit them with scleral lenses, and the moment gets to the point where they say this is the best that they've seen in like 20 years. You know, they go outside and they're seeing all the detail. They see the detail on their family's faces, and it's just one of those feel-good moments as an eye doctor that you were able to provide that for them, and it just feels good. You know, like it's kind of like that miracle of vision type of experience. And I think a lot of eye doctors that fit scleral lenses have experiences like that. Wouldn't you say?
Definitely, yeah. I think as eye care providers, there are certain treatments out there that are kind of routine. Updating the glasses prescription every year. It's fun. Patients get to pick a new frame out and get new lens technology and things, and that's great. We get to fit people in soft contact lenses. Sometimes the prescription changes every year. Sometimes we'll switch the brand out. But the use of scleral contact lenses, specialty fit, custom contacts that you can customize in so many ways, like you said, those are things that can change an individual's life as far as improving their entire quality of life. Glasses in general improve quality of life. But as far as just getting a prescription update 1 year to the next, that's a major improvement in life. But the use of sclerals might take somebody from not seeing very good at all their entire life to seeing nearly 20/20 vision for the first time in their life. Mm-hmm. And it seems miraculous, almost, this type of treatment. This technology that has advanced, has been around for a while, but has recently been utilized a little bit more for certain eye conditions out there. It's definitely an ultimate game changer for a lot of people as far as eye care treatment.
Yeah, and I would say that probably the majority of patients that are fit in scleral lenses, usually have a certain type of condition involving their cornea. So the cornea, the front clear dome of the eye, where it kind of starts focusing the light to the back of the eye, it should have kind of a nice, smooth, curved surface to it. And for whatever reason in that person, they might have keratoconus, where it's more cone-shaped. And so that cone is bending light, focusing light in a weird way. And there's some other, corneal irregularities, marginal pellucid degeneration, where they have kind of different types of curves in that cornea. Or even people with high astigmatism. I mean, people that might have a regular curve to their eye, regular astigmatism, but they just have large amounts of astigmatism, they might not see that well with glasses or with normal soft contacts or hard contact lenses. And then they try on a scleral lens and like, whoa, like their vision's clear, stable. It works really well. Any other conditions that you can think of?
Yeah, definitely. Dry eye is also another one in there.
Mm-hmm.
That's huge. There's a lot of different treatments, advanced treatments, new treatments for dry eye, but the use of scleral lenses, because it's basically a contact lens that is filled with preservative-free saline and then placed on the eye, so you have this pocket of fluid trapped underneath the contact lens all day, not only creating a brand new smooth surface to the eye if there's a cornea that's irregular due to heavy scarring, post-corneal transplant, high astigmatism, whatever the case is. It also can be used for severely dry, roughed up eyes. It blankets it in moisture all day long and is extremely healing for that in terms of dry eye.
Yeah. So yeah, that's right. Dry eye. I mean, I even have a video about that, actually, scleral lenses being used for certain dry eye conditions, and videos of how to put them in and take them out. Now, scleral lenses, they're kind of a different ball game as far as contact lenses are concerned. So as Dr. Smith was saying, they're definitely bigger than the normal, soft or hard contact lenses, and it's kind of used a little bit different. So they're bigger, so can be harder to get in the eye, and you actually fill it with solution, and so you're actually kind of putting it in a different way so that solution stays in there, that you don't spill the solution out and then taking it out is a little bit different. So that actually brings up my first funny story here. So this story is actually where a patient did not continue with scleral contact lenses, and it's actually right after I got out of optometry school. And so it was my first year out. I think it was maybe my third, fourth patient that I was like fitting with scleral lenses. And this patient had keratoconus, big guy. I mean, like just big football player type of guy. And he had actually never worn contacts before. He's just been wearing glasses because he's kind of just, a little bit freaked out about someone touching their eyes or him like trying to put something in his eyes. But he's just, sick and tired of having blurry vision, not having good enough vision with the contact lenses. So let's say, hey, let's just go for the best one. Let's go for scleral lenses. So if you can imagine, big guy, like, okay, let's put this first scleral lens in. So usually when I'm fitting a patient, I'll put it in the first time because it is tricky and we want to fit the scleral lens properly to the eye. So in order to put it in, you actually have the patient, lean forward so they're pretty much parallel with the floor. And so then you're going to fill the contact lens up with the solution, and then you're going to place it on the eye, kind of like that. Now, so the patient's kind of leaning forward. We're getting ready to put the contact in. So I'm getting close, and his eyes are just freaking out. He's tensing up. His eyelids are closing. His eyes kind of freaking out. He's starting to arch back a little bit, and so it's just very difficult to put the contact lens in. And so he's like, okay, you know what? Hey, maybe let me try. Maybe I'm just like getting freaked out because, you're getting close to my eyes, and I don't want someone like touching my eyes. So I'm like, okay. So I'm kind of watching him. He's kind of leaning forward. He's got the contact lens ready to go. He's opening up his eyelid. And, he's like really tensed up, holding his breath, like straining. And he's down there holding his eye open, gets really close, and then his eyeball pops out.
Oh, no.
Popped out. So, and so now, again, this is my few months out of school. And so everything turns slow motion after that. So he kind of leans up and, he's kind of trying to blink a little bit, but his eyeball's kind of keeping him from blinking. And he's like, it's stuck. And then that's when I kind of realize, oh, okay, he doesn't know that, he doesn't know that his eyeball is kind of like sticking out a little bit. He thinks the contact is stuck on his eye. So everything's like slow motion after this, like, holy cow, like his eyeball has popped out. Now, it might sound like I'm exaggerating a little bit. It's not like it's popped out and was like hanging by the optic nerve or the muscles. It was kind of bulged out, kind of like you see on those videos where people with, Graves' disease, their eyes kind of like, pop out of the socket a little bit. But everything was slow motion. I was like, holy cow, this guy's eye popped out. Who do I call? Do I need to call an ambulance? And I'm like, who do I call? I'm the eye doctor. They're going to call me. I'm the guy that has to fix this right now. And so all I could think of to do was just, I kind of cupped the eyeball and kind of just pushed it back in the socket.
Popped it back in.
Yeah, it's kind of like if you kind of imagine like pushing Jello through a small hole. So it's kind of like just sucked back in there, and then his eyelids blink, could blink again. Then he's like, oh, we got it. And then he realized, the scleral lens was still in his hand. And so I had to tell him, yeah, your eye popped out of its socket. Let's we're not going to do scleral lenses. So,
You're not a very good candidate for sclerals.
We
after
abandoned
all,
that. Yeah. So that's the only time that's ever happened. I even called ocular plastic specialist and said, hey, this guy's eye came out when I was doing a scleral lens. He's like, I've never heard of that happening. I'm like, oh, good. Okay, that makes me feel better. What do I need to do? He's like, well, could he move his eye after you put it back in? I'm like, yeah. His vision was great. We checked everything. He's like, good, you're good. I think I had him go in and check his thyroid levels, because I was like, okay, what are we kind of on the edge of Graves' disease or something?
Sure.
But no, he ended up being fine. He actually fitted him with a different hard contact that actually worked really well. But yeah, scleral lenses, no. That's the only time that's happened to me. It did kind of make me timid to fit scleral lenses after that. I was like, oh my gosh, I didn't know like these, people's eyes will just like fall out when I'm fitting these. But it's rare, obviously. I haven't heard of that happening anywhere else, but that was a crazy story. Guy's eye popped out in front of me, so it was nuts.
Well, I think that's great that you've become kind of an expert in treating scleral lenses, because you said that you right out of school when that experience happened to you, obviously that didn't deter you from wanting to continue to help people out with the use of custom scleral contact lenses. So way to continue to practice and improve your skills there, and despite that experience.
Yeah, and it's been worth it. I mean, I've had, a lot more pleasant and beneficial experiences since then. So now it's just kind of a funny story.
Yeah, definitely. I imagine the experiences have been much more rewarding. There's been more rewarding experiences for you than negative ones.
For sure.
I haven't had that happen to myself. That could happen to anyone who has eyes and the anatomy to where some people can pop their eyes out on their own without even touching their eyes or anyone else manipulating their eyes. And we've all kind of seen those little videos on social media that sometimes pop up where somebody has a surprise look and can pop their own eyes out.
Yeah.
So obviously this individual probably had the ability to do maybe a little bit of that or close.
Just didn't know it. Yeah.
Yeah.
Maybe since then he's developed that skill or talent to pop the eyes out. He just didn't know it, and then usually people can just like pop it back in. So.
Right. Definitely an eye-popping experience for you, though.
Oh. Jeez. Oh boy.
We had this probably happened about a year ago, but as you can imagine, very custom hard contact lenses that are larger diameter lenses, they're not the most inexpensive contact lenses out there either. They are an investment. They are something that some people tend to have to think about for a minute before they get at times. Other people are, they understand and they get it, that it's going to improve their eyesight, that it's actually going to be comfortable for one thing. Back in the 90s, when those small hard contact lenses were kind of mainstream, those were known for discomfort because when people blinked over them, the edge of the contact lens would interact with their eyelid until they built a little callus under their eyelid and it stopped hurting after a couple weeks, right? Well, scleral contacts are, they are known for comfort because they're large enough. They're tucked underneath the eyelids, but either way, they're an investment, and they can cost a lot of money if you're paying out of pocket. Can you put a price on good vision, though? That's also the question. But a lot of times vision plans will help kick in and pay for sclerals as well. But we had a story where an individual decided to make an investment in his eyesight, and this individual had an important job where they required good eyesight for. And so this individual needed to see dramatically better and had a condition that was basically causing the eyesight to be limited without the use of special custom fit contact lenses. So we fit an individual with contacts. Both eyes needed it real bad. We, through the fitting process, we knew that this individual was going to be a very good candidate because the eyesight just on the trial lenses themselves were improving the eyesight dramatically, better than this individual had ever seen. So we went ahead and went through the fitting process. This individual came in, your new contacts are here. We're going to have you come in, put them on your eyes, check the fit, and go through all that. They came in, they were real excited to put their very first made scleral contact, custom contact lenses on. And as we were doing the little fitting class, they were going to put their contacts on, and they bumped them off the table. And this was after it took a couple weeks for them to be made, and even longer because it maybe took a while for the insurance to be billed and all of that process to be taken place and done. But they dropped the contacts, both of them, onto the floor, and as they were looking for them, they stepped on both of them and crushed them both into just probably 50 pieces, a pile of small little parts, just crushed them both. Took them out.
Dang.
After all that waiting and that custom fit and everything. And luckily those contact lenses were under warranty. The manufacturer worked with us, but it was a moment of panic for not only the individual who had made the investment in those contacts, but also for the individual that was doing the class, and for the team, and for everyone who had invested their time into fitting this individual in these custom scleral contact lenses. But luckily that one turned out okay. We were able to get the contacts. It took a little bit longer wait, but the story had a happy ending. The contact lenses ended up working and coming back, and they didn't have to rebuy them again. So yeah, stuff can happen that you don't plan for, because these are contact lenses that can last you a full year at least. It's one set of contacts. Longer. It's not buying boxes of contacts like soft contact lens wearers are used to.
Yeah.
It's one set that you take care of and you take with you, and you do your best to take care of day in and day out. I have another funny story that I recently heard of. Maybe not that funny because it could have turned out pretty serious for this individual, but actually yesterday I read this story that came up on LinkedIn. There's a doctor in Algeria who shared some pictures, didn't share any patient information or anything, but shared an interesting case of a patient that was fit in scleral contact lenses. They put their contact lenses in one morning, and they came in because their eye was red and irritated after putting the contact lenses in, but they didn't know why. So they came into the clinic, and that clinic said, let's sit you down, let's look at the contact lens, let's see if we can figure out what's going on. And so as they looked at the contact lens under the microscope, they found that there was a ant stuck behind the contact lens, kind of sandwiched in between the contact lens and the surface of their eye, just sitting in there, just crumpled up and dead, floating in the bottom of that little pool, that little bubble of fluid, causing the cornea to become irritated. And so they were able to, after taking pictures, which we can probably safely share some pictures of that on this video, we're able to remove the contact lens and flush the ant out and take care of the patient. But you wonder how that might happen. A patient, would get an ant and not see the ant before the contact lens was placed on the eye. But if you're a far-sighted individual, and and this happened to a 40-year-old male, but if you're 40 and up and you're farsighted, that means that it's very hard to see things up close. And if you're putting on a contact lens and you fill it up with fluid, and an ant somehow
got in there,
makes its way into the little tiny pool, you're not going to see it. You're not going to see it at all. In fact, some people wear contact lenses where they have this modality of fit called monovision, where one eye is corrected for far, the dominant eye is corrected for far, and the non-dominant eye is corrected for near. And they have a habit of putting the near contact lens on first, so they can then see to put on the distance contact lens with their dominant eye. And so I definitely can see how an individual could accidentally have an ant or any other object fall into their contact lens somehow, some way, and not see it until they go to the doctor and find out that there's an ant stuck in their contact lens.
Or maybe the ant crawled in their eye and was in there, whatever, scratching around before they put the contact in, and just happened to trap the ant on the eye when it was already there.
That's a problem. That's a problem if that happened. Either way, whatever happened, I'm sure that ant was bugging that patient pretty bad.
Jeez. Yeah.
For quite a while until it started to feel better.
So I just realized we're kind of like sharing like nightmare stories of scleral lenses. Really, scleral lenses are awesome. Even looking every story we share is like, oh, there's an ant. This guy's eye popped out. But really, like those are interesting stories. Like, the majority of our stories, at least mine, have been like, holy cow, my vision's great. I love these. Like you really are providing like a great service, great vision to most of these patients. There's it's just a few of those stories.
And there are plenty of stories probably even more stories about soft contact lenses that we've probably all experienced, right?
Yeah, there's nightmare stories with everything, or like crazy stories, like the lady getting 28 contacts lost in her eyelid or whatever it is, so it's, so weird stuff happens.
Yeah, true stories out there for sure.
Yeah. So another thing to mention about scleral contact lenses is they are actually making augmented reality contact lenses, and they're actually taking scleral contacts that we fit in these patients, and they're combining the augmented reality in this type of contact lens. And so that's really interesting because you can have people that might have lower vision, poor vision, that might need scleral lenses or benefit from scleral lenses, and then on top of that, they can put augmented reality. In fact, I think one of the key demographics that people are that they're targeting are people that have low vision, where you can actually wear this contact lens and it will highlight, outlines of the walls and the doors and couches, and so you can get around more. And obviously there are going to be many other applications for them, but so it's kind of an exciting, field. Especially with eye doctors that kind of love scleral lenses or fitting scleral lenses already, might have a chance to fit scleral lenses mixed with augmented reality. So kind of exciting.
And if I could throw in one more little thing, sometimes individuals might go to an eye care clinic that doesn't necessarily do specialty contact lens fits, and they might have a high amount of astigmatism, and that's going to be with them their entire life. And soft contact lenses might not work at all for that individual. So if you are an individual that hasn't been able to be fit in soft contact lenses, but you want to wear contact lenses pretty bad and get out of those glasses from time to time, scleral lenses are the solution. And you can actually wear contacts, but it would be a specialty fit custom hard contact lens called a scleral lens. And so you could ask your eye care provider if they fit scleral lenses if you are an individual that has been told in the past that you are not a good candidate for soft contact lenses due to high astigmatism or keratoconus, or your eyes are too dry and irritated, or you've had a corneal transplant and you just can't wear contacts, or post LASIK or something like that. There are contact lenses for most individuals out there. They just have to be the right ones. You just have to find the right individual, the right clinic that specializes in that type of fit.
Yeah. So again, this was part 4 to this video series. We have other videos where we touched up on great topics. Make sure you check that out. I'll put the video series link in the description below. Also, check out Dr. Smith's channel. I'm going to put a link to his video right here where he actually put 27 contacts in his eye to show you if it was dangerous or not. It's actually a super interesting video. But yeah, check out his video. Also, if you have any questions, leave them in the comments below. You can tag Dr. Smith, tag me. We'll try and do our best to answer any questions that you have. Thanks for watching. Stay focused.